Thank you so much, Mr. Chairman. In comparison to the population at large, starting at age 65, older Americans are more than twice as likely to be killed or injured by fires. Many older Americans experience poor eyesight, loss of hearing, arthritis, dementia, and side effects from medicine that can make it difficult to react to a fire. I've introduced legislation, the Housing Temperature Safety Act, which would require the installation of heat sensors in federally subsidized housing. I'm also a co-sponsor of the Public Housing Fire Safety Act, which would provide funding for public housing agencies to install automatic sprinkler systems. Dr. Parekh, what impact would require further installations of fire prevention mechanisms such as heat sensors and sprinklers have on older Americans? And second, do you believe it would be significantly and meaningfully helpful to increase the safety of older Americans towards housing fire dangers?
Senator Gillibrand, thank you for that question and this important public health issue. I think certainly there is data to support automatic sprinkler systems. Heat sensors also can be a sensitive way to detect a fire. So I do think that these interventions should be looked at. Certainly the feasibility, the cost studied as well. I will also say that more broadly in terms of fire prevention, if you look at older adults, the most common cause of home fire deaths in the elderly still is smoking. So smoking cessation, I think, is critical here, ensuring that there are smoke alarms, battery operated, ensuring that there's cooking safety, space heater safety, the use of space heaters. All of these prevention tools, in addition to the interventions that you're articulating, I think could make a big difference in reducing fire deaths in the elderly population.
Most older adults prefer to remain in their homes and communities as they age, yet many older adults face significant challenges to safety and independence because of modifiable risk factors in their homes. Unintentional home injuries cause more than 30,000 deaths and 12 million non-fatal injuries annually in the United States. Home improvements, modifications, and repairs can enhance home accessibility over a person's lifespan and reduce the risk of unintentional injuries. These improvements may include addressing unsafe furniture or appliances or supporting balance to reduce risk of falls. For Ms. McGee, thank you for sharing your story. I know that it cannot be easy, but I appreciate you bringing the awareness to this issue. You mentioned the STURDY Act as a piece of legislation that would help prevent injuries and harm from furniture tipping over. Can you please describe the standards this legislation would set to stabilize furniture and how it would help prevent dangerous incidences of future furniture tipping?
Absolutely. Thank you for this question, Senator. As many people on the call know, the Consumer Product Safety Commission released an NPR last year after 4+ years of investigating the tip over issue. And their 1,200-page document was a lot to read, but it does say one thing very clearly, and that is that the current safety standard is woefully inadequate. We as parents already knew this. We knew of units that meet today's safety standards that have fallen over. We actually have a parent in our group who lost her son in 2017 from a dresser that meets today's safety standard and is still being sold in stores today. We know that change is coming. Manufacturers know change is coming. We stakeholders are all in agreement that STURDY is the best way to get this done. The STURDY Act requirements would hold manufacturers accountable, not only because it would be a mandatory standard rather than voluntary, but also because it would test for those real world use scenarios that I had mentioned that are not being tested for today. So dressers being loaded with clothes, which is how we use them, multiple drawers being open at once, dressers being used on carpeted surfaces, and the dynamic force being put on dressers during real use scenarios.
Yep. Well, thank you very much. And thank you, Mr. Chairman, for this important hearing.
Thank you, Senator Gillibrand. We'll next turn to Senator Braun.
Thank you, Mr. Chairman. I have had